the Mental Health Commissioner in Albany County. I oversee the Department of Mental Health, and I also oversee the provision of services throughout the county of many community providers. We're first and foremost a human service agency, and we provide behavioral health services to the community. We have about 100 employees that work directly for the county mental health department, so I oversee them. And we partner with dozens of community agencies to make sure the community gets the services that they need. I am a psychologist by training, and I've worked in the educational world and the private practice world for over 25 years. And I've been the commissioner for the last 14 years, working for the county for 35. So I've done a lot of different things in the county, but my interests have always been in community mental health. And the government opportunities gave me a chance to help more people than I could in any of the other roles I had. You know, I can't do the work alone, and our county executive sets the tone and the direction for all of the efforts in our department. He has always made it clear to me that the work in the mental health department and the behavioral health space was vitally important, that there's no health without mental health. And we partner with our health department to kind of achieve that mission, and the county executive has been a stalwart supporter of us from the beginning. So we have a clinic, we serve 800 or so people. We have a mobile crisis team. We were the first in New York State. 24/7, we respond anywhere in the county for psychiatric emergencies. We have an addiction clinic. We have services at our correctional facility where we have a fully staffed clinic that serves over 250 inmates at any one time. And CORD is an acronym for Albany County Crisis Officials Responding and Diverting. And it was designed to try to minimize the involvement of law enforcement in mental health emergencies. We have a social worker and EMT that respond to emergencies in the community. If we need police, we call them, and if the police need us, they call us. Our mobile outreach treatment and overdose response program. We work with local agencies, and we respond to people who have survived overdose in the community to try to prevent them from overdosing again, hooking them up to services. We're a safety net provider, and what that means is that, you know, the private, for-profit, and even some of the non-for-profit agencies pick and choose. They could say no. We don't say no. We can't say no. We serve everyone who comes to us, and most of the time they're impoverished in one way or other. They're disabled in one way or another, and so many of our other county departments do the same thing. Social services, health department. We work closely with both of those. We're in daily contact with our probation department, and as I said earlier, the correctional facility where we have a strong presence. The thing that is most rewarding is getting letters from a family member or from a patient, or just running into one person who, you know, remembers us, but I may not remember them, but they tell us that their life was changed. We're reminded that we're impacting people's lives sometimes in a life-saving way.